Good morning, everybody, and welcome back to your Lunch Break Live. Today is Wednesday, January the 13th. My name's Ivana Harinkyu, and today we are going to do something that I think a lot of people will find valuable, and that is answering some of the most frequently asked questions we have received regarding vaccines for the coronavirus here in Alabama. We put out a call earlier this morning on social media asking for all of your questions, and we were overwhelmed with the response we've got. I've got pages here in front of me of all of these questions. We're going to do our best to get to all of them, but because you have so many questions and because the information coming out about these vaccines is changing so rapidly, we are going to bring on our coronavirus and vaccine reporter, Dennis Pillion here. We're going to bring him on more regularly to answer some of these vaccine questions and give us that information as it evolves. So Dennis, I don't know if you knew that, but that is what the plan is going to be.
Well, thank you for letting me know.
Yes, absolutely. Well, if y'all have other questions that you didn't leave on those call outs earlier, please drop them in the comments here. We will do our best to answer them. And then we're just going to get going with the questions that I have here in front of me. I am going to start this off by just telling you neither Dennis or I are medical professionals here, but the information that we are giving you is coming from several sources. That is from the Alabama Department of Public Health, the CDC, and also from other medical experts that we have spoken to here in Alabama. That includes people like Dr. Landers and Dr. Scott Harris from the ADPH. That includes physicians like Dr. Michael Thag from UAB and other UAB physicians as well. So if you have questions about where this information is coming from, that is where our answers are coming from. That's the information we're passing along to you. So if people need sources or any of that kind of information, feel free to ask and we'll let you know. But I just wanted to go ahead and get that out of the way. Dennis, again, this is Dennis Pillion, our kind of coronavirus and vaccine reporter here. And Dennis, we've got a lot of questions, so let's get started. First, we have a question about the rollout. This is from a lot of people, but I pulled a specific one from Twitter. And this person says that with the CDC trying to speed up the doses, when will people of us in that middle range, maybe not over 75, but also over the age of 18 with no pre-existing conditions and no essential jobs, be able to get this vaccine?
That's a good question. That's what everybody wants to know, but unfortunately, we just don't have a timeline for that right now. A lot of that depends, as the Department of Public Health will tell you, on supply. There are probably the rollout isn't going as fast as a lot of people had hoped for, but it really is starting to build up around the state. The vaccine, as we get more supplies of it, it's being distributed out to more places. More places are getting signed up and getting approved to distribute the vaccine, to give it to people. So it really is kind of about building out that infrastructure. And when can we literally just receive the doses, the packages of the vaccine to give out to people? So we can't really put a specific timeline on that. As you mentioned, the CDC and the Department of Health and Human Services, they really made a pretty dramatic announcement yesterday that they're trying to speed up that process. They're trying to get as many people vaccinated as quickly as possible. And they're greatly expanding the number of people that they say should be able to receive the vaccine. The problem right now is that, like in Alabama, we don't have the supply. We don't have enough doses to give out to people, for all the categories of people that they say should be able to receive it now. So it's going to take a while to work through that list, and even as the list maybe becomes less important, or they change they move the list around a little bit, it's still largely a matter of supply at this point. Now, Governor Kay Ivey has said that people over 70 or people 75 and over should begin receiving the vaccine next Monday on the 18th. That's kind of a statewide rollout. Some places have already begun offering it to people over 75, but this would be for the entire state next week. But that's really the only concrete date we have. After that, it's just a matter of how quickly can we get the supplies into the state, to the different medical facilities, and then how quickly can they bring the people in and actually get the shots in the arms.
So that is an important date to note, that January 18th, which is next Monday, also Martin Luther King Day, Martin Luther King Jr. Day, a holiday for a lot of people. That will be when the state is statewide opening up those vaccine slots for people over the age, 75 years of age and older. Now, we know some counties have already done that, some places across the state, but that will be a statewide rollout. So before I move on away from this topic, Dennis, if you are one of those people who is 75 years of age or older, you haven't been able to get your vaccine because your county has not been offering it to your group yet, what do you do on Monday to make sure that you're getting in line?
You actually don't have to wait till Monday. If you are 75 or older right now, if you are a first responder right now, if you are a medical health professional right now, you can call. The ADPH has a statewide vaccination appointment hotline where you can call, you can give them your information, and they can get to you about getting your appointment scheduled to get this vaccine. You can do that right now if you are in those groups, if you are 75 or older, if you are an emergency first responder or a health professional.
That number, we've put it here in the comments so people can quickly see it and call. But if, again, just to repeat what Dennis said, if you are in that group, 75 or older, if you're a first responder, if you are either eligible right now or you're going to be starting Monday, go ahead, call that hotline from the Alabama Department of Public Health, and they can get you set up. That number is 1-855-566-5333. In our comments here, so you can grab it right there.
Yes, and the state is also creating an online registry to do that. That has not yet launched yet, but they are working on that. But again, this hotline was just launched on last Friday and was immediately just inundated, flooded. They got over 1 million calls on the first day. So they're asking people to only call that number if you are eligible to make an appointment for the vaccine. So if you're 75 or older or a first responder.
So unfortunately, and like you said, we know that vaccine hotline is being flooded with calls, but we've got a lot of people who saying they have called so many times and they cannot get through. We've got Evelyn saying she's trying to call to get her 90-year-old mother vaccinated. So what do people need to do that can't get through that hotline?
So there are a couple of alternatives. If you live in Jefferson County has created a system to kind of take some of the burden off of the statewide system. So there is a separate number for Jefferson County, and Jefferson County also has an online sign up. And that was kind of hoping to this ADPH is directing people, if you live in Birmingham, if you're in Jefferson County, to call that number instead of the statewide line to try and ease the burden. But also, and just asking for people, if you are not eligible to receive the vaccine, please leave that number for people who are.
And that number for that Jefferson County line is 205-858-2221. Again, that is in the comments here. You can grab that number so you don't have to rewind and listen to me say it. It's right here in the comments. And that is, unfortunately, that's all we know about the vaccine hotline. I know a lot of people have had a lot of problems getting through. We do know that soon, we know the Alabama Department of Public Health is set to announce a online registration. But if you're in Jefferson County, you can try that local number, see if you get through a little bit quicker. And Dennis, I think it's fair to say you'll be following up on it to see if more people will be staffed to man that hotline or what's being done about that hotline.
For sure, absolutely.
Now, just so I can make sure we get to as many questions as possible, let me ask something that I had asked a little bit earlier. I had asked to me a little bit earlier, and then people here in the comments have wondered. I think Lucy or Linda has been asking. There are new CDC guidelines, new guidelines that have come out from federal experts saying that people 65 and older should go ahead and be eligible for that vaccine. And that is extremely confusing to those of us that live in a state that is still not even widely vaccinating people over the age of 75. What can we make of these new guidelines? Will they be implemented in Alabama?
It is extremely confusing, and I think it was extremely surprising for a lot of people. There has been criticism about this kind of slow rollout, but I don't think anyone necessarily expected the federal government to come out and do this yesterday. The CDC, they set up this kind of tiered system where first it's healthcare workers, and then on down the list. And now they came out yesterday and said, we need to ease up on the tiered system because it's slowing this thing down too much. Now they're saying we need to open it up. And they're really kind of putting the onus on the states to do that. I had some brief communication with ADPH. They're aware of these recommendations that just came out yesterday afternoon. They say they're still waiting for more information from the CDC on how exactly that's going to work. And then, the other factor too is that these recommendation changes, came from the Trump administration, from a CDC director, and from a Health and Human Services secretary who, are not going to be in their jobs a week from now. There's going to be a changeover in the administration. So what role is that going to play? We don't know. There's a lot we don't know about these changes that came out yesterday, and we're still trying to figure that out. But really, everyone is working as best they can to try and get this out to as many people as possible, as quickly as possible. And they're still working through that. Thankfully, the good news is the manufacturing and the distribution of the vaccines seems to be going well so far. We're getting more supplies in. As this infrastructure gets set up, more places will be able to give out the vaccine, so that will help. But there's just a lot of frustration, a lot of confusion about where we are right now, and why we're not further along. But then also, really, how do we get there? Just changing a guideline recommendation doesn't mean that the hospitals have more of this vaccine in their freezers. They have to have more supplies before they're actually able to act on those recommendations.
So, right, the short answer to that is right now, Alabama is not doing 65 and older. They are doing 75 and older beginning on Monday. Right now, just healthcare workers, but first responders, 75 and older, eligible starting Monday. Now, I want to answer just a couple of quick questions that I can quickly answer. Johnny Lynn asks, how long after testing positive should you wait to get your vaccine? Johnny Lynn, I spoke with Dr. Michael Sag just the other day here on this show, and he said that people who have tested positive for coronavirus need to wait about 3 to 4 months before getting their coronavirus vaccine. Just answer that one quickly. Another question, and I cannot find it on my never-ending sheet. I believe it was from Ruby, asking about the ingredients and asking about any aluminum in that vaccine. Ruby, also in that interview with Dr. Sag, the doctor said that there is one ingredient in that vaccine that I cannot pronounce the name of, so I will not pronounce the name of it, that is only for people who are allergic to that one specific ingredient, and it was not aluminum. So if you are allergic to this one specific ingredient, that was the one that he said to worry about. I'll link that video with the doctor here so you can go back and watch that one, but he did not mention anything about any aluminum in that vaccine. So, Dennis, let's move on to a couple other questions we got a little bit earlier today, and that talks about the distribution that we have had here in Alabama. We know nationally this is not exactly moving as fast as most people would like, but especially here in Alabama, we know that there is a discrepancy between the doses allotted and the doses that have actually been injected into people's arms. So, William asks, what efforts are being made to ramp up that distribution?
Well, the distribution, when we look at, there's a lot of different numbers that can float around, and it can be hard to get a clear picture of exactly what's happening. But so there are different numbers here. There's the amount allocated, which is one number. Then there's the amount that we've actually received. Some of that has been allocated to us, but it hasn't been shipped to us yet, and it's still being distributed out throughout the state. Obviously, the Pfizer vaccine especially requires that ultra cold storage. So that's another hurdle to getting that out there. That really is only, for the most part, going to be compatible with your large hospitals that can have that deep freeze, that negative 70 degrees storage. And then, hopefully in the not too distant future, we have pharmacies, we'll have smaller medical facilities, we'll have all these places kind of building up that infrastructure, getting the coolers, if they need it, getting signed up through these federal vaccine programs to be able to, hopefully before too much longer, you can go down to your local CVS or Walgreens and make an appointment and get the vaccine there. We're not there yet. There are actually 3 pharmacies in Alabama now that are kind of part of a trial program that are offering the vaccines to people who qualify. So at this point, healthcare workers, but I suppose beginning on Monday, then people 75 and older. But that's just kind of a test program to kind of work out the kinks. Hopefully that'll be expanded to a lot more places here in the coming weeks. And we also might have other vaccines getting approved. Right now we have 2 vaccines that have gotten that emergency use authorization from the FDA. There are more in the works. The AstraZeneca vaccine and the Johnson & Johnson vaccine, they're getting a lot closer in that process. Some people are speculating we might have a third vaccine get that emergency use authorization by the end of the month. And then that would be, another company mass producing these vaccines and then shipping them out. So that would really help out the supply side of things.
Asking just a lot of people saying, when can I go to my Publix, Walgreens, CVS? That is not available yet here in Alabama, unfortunately. We don't have a date that's going to be available, but we will keep you updated on that. Now, this is, I think, a very interesting question here from Gage. I'm going to read it as I've got it written down. And this was from Twitter. He said, if I got my first dose before they started allowing appointments for elderly, am I guaranteed my second dose? I got it at an urgent care that does not take appointments. Should I go back there and try to get an appointment, or what should I do?
Yes. I mean, the first thing I would do is contact the facility where you got the vaccine and, explain the situation. Initially, during this rollout, there was a lot of concern about do we need to hold doses in reserve to make sure everybody who gets a first dose can get a second dose. Now we've kind of shifted away from that, really, as of yesterday, and that announcement from CDC, in that we want to get as many people the first dose as possible. And because, the manufacturing, the production of the vaccine is going along well, we're just going to kind of assume that we'll have, that second dose available. We're not going to not give someone a first dose to make sure that we have enough for the second dose, because we think the production is going well, right? We think that, unless something bad happens at a factory, we'll be able to keep, producing this at the same level. So we should be, when we look a week, 2 weeks, 3 weeks down the road, we should have more vaccine available, not less. That's the idea anyway, and we're hoping and assuming that's going to work out that way.
So right now we know that we are still in this 1 phase, right? We're maybe moving down into 1B with 75 and older. We do know there are other people included in that 1B phase, including teachers. I have a lot of teachers asking when they're going to get theirs. So Dennis, when is full 1B in all of its full stages going to be available to people here in Alabama? Everybody in that 1B category. And can you name those people?
Yeah, so the answer on that is we do not have a firm date. Dr. Mark Wilson, the Jefferson County Health Officer, spoke on Monday, and he said we're kind of in a 1A plus. So we're all of 1A, and then certain populations from 1B being people 75 and older and first responders. And that's who is going to be eligible to get this vaccine starting on Monday in Alabama. The rest of Group 1B includes a lot of people. It includes teachers, education workers, childcare workers. It includes basically
people
all
who are essential workers.
Yes, essential workers, and they actually. There's a full list that I don't have in front of me, and I'm gonna blame myself for missing somebody, but.
So that phase 1B, we're not in yet. And unfortunately, when I spoke to Dr. Karen Landers of the Alabama Department of Public Health about a week ago, Dr. Landers said that there will not be a flipping of the switch, if you will, going from 1A to 1B to 1C, which I think is very disappointing for a lot of people, because that is what we would like to happen. We would like for there to be an announcement on our tornado sirens that says, hey, 1B, go for it. But unfortunately, that is not the case here. Like you said, Jefferson County said they're in a 1A plus. So right now, first responders, healthcare workers, people 75 and older are those people that are eligible to make their appointments.
Yeah, and hopefully as the state, when things calm down with the state hotline and as they get the online registry set up, the Jefferson County online registry is really helpful because you can go ahead and put your name down on a list. You can say, it asks you several questions about your age, your occupation, whether you have, any of a certain list of pre-existing health conditions that might put you at a higher risk. You can input all that information into the tool, and then they will contact you when it's your turn. When they say, okay, maybe it's Monday, maybe it's 2 weeks from Monday, maybe it's 3 weeks from Monday, whenever, but they will contact you and say, you're now eligible to get the vaccine. Here's a list of places where you can receive it, contact one of them and set up an appointment. And I think Jefferson County has that working now. Hopefully the state can get a system like that up soon. I think that's going to be, probably a good solution to these issues with these hotlines being flooded and people not being able to get through.
Well, and we know too, at least for me, if I can do it online, I would rather do it online than having to get on my phone and call somebody. But that Jefferson County website where you can sign up to be notified is not guaranteeing you an appointment. It is not making an appointment. It is basically signing you up to get an email, a text, a call, a notification that says, hey, you are eligible. I recommend that. It was very easy. I did it myself. I actually did it for myself and my mother and for my husband. So went through it a couple times. It was very easy to do, and you do not have to worry about getting a busy signal, which is what so many people are having when they call that hotline.
And the other good part too is that they'll tell you where you can get it. They'll tell you which places are, in your area are actually distributing the vaccine, are taking appointments. So it'll give you a leg up from trying to figure out how best you can get it as quickly as possible.
Question from Lindsay. Is this safe for people with autoimmune disease who are on immunosuppressants? Lindsay, I would say talk to your doctor, but I will say that Dr. Michael Sag, who was on the other day, and other medical professionals we've talked to very much recommend the vaccine for people who are on immunosuppressants who have compromised immune systems. They are recommending those people be some of the top people and a top priority to get this vaccine. Question from Bryn. If you've gotten the flu shot every year and have never been allergic, will it be the same for this one? Bryn, while I don't think anybody can guarantee that 100%, Dr. Sag did say if you do not have an experience with severe anaphylactic reactions to vaccines, then there is no reason to believe that you should be allergic to anything in this vaccine. If you've never had that problem, then chances are you shouldn't have it. Again, though, that is just what our experts have said. I'm sure nobody can give you that 100% guarantee. Now, we have questions, Dennis, about drive-through facilities. Why some counties have drive-through vaccination kind of clinics, why some don't, and why some, like we know one here in Birmingham for healthcare workers, the first dose was a drive-through situation. When these people came back for their second dose, it was not. People had to stand outside, wait in the cold. Why are the drive-through clinics not the standard?
Well, it's those decisions are being made by the entities that give out the vaccine, whether that's the county health department or a private hospital clinic. They're kind of figuring out the logistics on the best way to go with that. And it's also even to a certain level, they're deciding. The local county health department might decide, hey, we have more supplies. So rather than waiting for any kind of announcement statewide, we're going to host this drive-through clinic and we're going to have, just try to get people in there and get it out and get as many people vaccinated as quickly as possible. So it's really just those kinds of local decisions and, people trying to figure out logistically what works best. And, it's evolving, we're learning, things are changing. They say, well, this worked, this didn't. So I suspect that we'll probably see more of those things going forward. I know the Jefferson County Health Department has talked about, kind of setting up these kind of remote clinics for, outside of the downtown area. So for people who, where travel might be an issue, trying to just make this available to as many people as possible.
I want to get to a couple of quick questions before we have to go here. One, do you have to be vaccinated in the county where you live?
That is a good question. I do not know the answer to that. I'll have to check up on that. I haven't seen anybody requiring that. Again, it's kind of up to these individual providers, right? Right now, we're in a situation where we're supposed to only be offering the vaccine to certain, people who meet certain requirements. And it's kind of up to whoever's giving out the vaccine, whether that's a hospital or a county health department or a medical clinic. Pretty soon this will be making its way to these like urgent care facilities, places like that. But it's going to be kind of up to them. So, I would, when you call to make your appointment, I would be sure and ask those kinds of questions. And it's probably, I don't think there's a statewide policy. It's probably going to depend on where you go to get your vaccine.
So that is another, kind of goes on to another question we have, which is people ask, how do I know where in my county I can get vaccinated?
Yeah, that is, fortunately, that's going to be changing because a lot more of these places are starting to come online. They're signing up. There's a registry and certain steps that these clinics need to take before they can get approved to give out the vaccine. So there's still some work that has to be done there. But the longer we go, the more places are going to be available to offer it. Hopefully within a few weeks. I don't want to put a timeline on it because we don't know how long it's going to take exactly. But that list should be growing. Again, I hate to keep going back to this, but probably the best way is to sign up for this online sign up if you're in Jefferson County or when the statewide version launches. And then that way you can be notified directly. And at that point, they should tell you, here are the places where you can call to set up an appointment. Because for the most part, there are a couple of drive-through clinics that have been first come, first served, but the vast majority of places that are giving out the vaccine are doing it by appointment only. So you would need to call and schedule in advance.
When do we know when the Alabama Department of Public Health will put up that online registration form?
We do not. We hope it will be soon. I'm sure they're very eager to get this online, if nothing else, to kind of ease the burden on the call center, on their hotline, and also hospitals. They put out an announcement over the weekend that hospitals across the state are just being flooded with calls. People are calling, trying to set up an appointment, and it's interfering with hospitals' business. They can't do what they are, usually have to do as a hospital because they're having to field all these vaccine calls. Mm-hmm. So I know there's a lot of urgency. There's a lot of momentum. People really trying to get this up as quickly as possible.
But isn't it fair to say that they should have expected this? This was not surprising. There was going to be a flood of people wanting information about how to get vaccinated, where to get vaccinated, who can get vaccinated. So have they addressed any sort of questions about the Alabama Department of Public Health, that is, why they weren't prepared to answer these questions and have the technology set up to do so?
No, we have not heard that specifically. So, and then, those are going to be the kind of ongoing conversations that we have with them as, we move into, there's this, kind of emergency push to try and get everything out. And then there's the retrospective look. And yeah, I think they absolutely should have expected, this kind of a response from people.
What phase are immunocompromised people in?
The people with certain health conditions, and I believe immunocompromised are on that list, would be initially in that, I believe that phase 1C. I'm going to cheat and look at my notes here for just 1 second, but
while Dennis looks up that answer, I do want to just tell all of you, we have so many questions that you have been asking. We're very grateful for those. We are going to do this regularly, bring Dennis back, and maybe bring some of our other vaccine reporters on as well to answer some of these questions, get out this information to you as quickly and efficiently as possible. So continue to give us all of your vaccine questions. You can do that on the social media. You can do that by contacting Dennis or I directly, and we will make sure that we work to get answers for you. Dennis, it looks like you might have the answer about that immunocompromised.
I got it now, yes. So it's, the way it's worded is persons age 60 to 64 with high risk medical conditions would be in this phase 1C, and people 65 and older, anybody 65 and older would be also in that tier. So
And that was
basically
16 to 64, I believe, not 6D to 64.
16, yes, 1-6.
Okay. 16 to 64 with pre-existing conditions in that 1C group.
Yes, and I should mention also that people with those health conditions, they were included in that push yesterday that came out from CDC. So CDC is pushing the states to go ahead and include people over 65 and people with those health conditions immediately and start offering it to those people. So CDC is pushing for that to happen. I think they said in 2 weeks was the deadline, but it's a matter of getting enough vaccine for those people to get.
Right. Right. Well, Dennis, we appreciate all the information that you've been able to give us today. We will leave those hotline numbers here in the comments where you can get them. We will also leave the website if you live in Jefferson County where you can sign up for that information. We'll leave all that here. If you keep coming up with these questions, let us know. We will come back, do this regularly, and answer them. So, Dennis, again, thank you. Everybody watching, thank you. Stay safe. We'll see you tomorrow.